HIV signs in window stage. You just acquired the HIV virus, so you're on your window stage. Or you're suspecting you have HIV virus, of course, it's in your window stage. These are some of the signs and symptoms you might experience. Remember, HIV is human immunodeficiency virus. This virus attacks a specific group of cells. They're called CD4 cells. Remember, HIV is a unique virus. It integrates its genetic materials into your host cell DNA. Remember, Windows stage is the stage between infection and the first day or the first sign that is seen of the HIV virus. In this day and era, not like in the 1990s, HIV is not a killer disease. You would also want to ask yourself, if you're enlarging your mind with the HIV information, HIV now goes ahead and causes AIDS. AIDS is acquired immunodeficiency syndrome. And these are some of the signs and symptoms you are to expect in the window stage. Remember, window stage ranges from 10 days to 90 days, depending with your immunity. Maybe you had a condom, it broke, maybe you engaged in unhealthy sexual activities, and now you acquired the HIV virus. Here are some of the signs and symptoms. Let's read them together as I explain. My name is Professor Gomba. This is called the Health Matters Plus. And as always, don't remember to share this important information with your siblings who are yet to know about HIV signs and symptoms in window stage. Let us start by saying that high fevers, high fever, this is increased high temperatures in the body. You have acquired a new virus, your body is trying to eliminate it in your body. Remember, and a virus, a bacteria, or a fungi, or any other harmful antigen, we call them antigen. They are antigens. Antigens are unwanted things like bacteria, viruses into our body. And when the body is trying to fight these bacteria and viruses, you're going to have high fever. It doesn't mean that if you have high fevers, you have HIV. But now, if you start to experience high fevers and you engaged in unhealthy sexual activities, could suggest you have HIV. Let's go to number 2. This is fatigue. Your body is trying to eliminate a new virus, a new antigen. The antigen is trying to integrate its genetic materials into the host cell DNA. Too much energy is being used. You're going to feel fatigue, extreme tiredness. Out of nowhere, you have not done too much work, but you feel extremely tired. There are some of the signs and symptoms of HIV in window stage. Skin rashes. Skin rashes could also be caused by fungal infection. But now, if you experience these two and now you start experiencing skin rashes all over your body, it could be a sign that you have acquired some HIV infection. The other one is sore throat. You cannot swallow something, you're feeling some sore throat, a disturbance in your throat. That is another sign of you have acquired HIV. The other one is much muscle aching. You because you're feeling tiredness, you feel a lot of muscle ache, and you have not done extreme work. That also could be another sign that you have acquired HIV. I said these are 10 signs and symptoms that you could have acquired HIV. Let's change the lighting just a bit. This is saying swollen lymph nodes. You could ask yourself, what is swollen lymph nodes? I think this side is better. So swollen lymph nodes are found in these areas. Lymph nodes, they're very swollen. This is where more cells to fight the HIV virus are being produced. All right, so they are swollen, they have been overworked. We want to eliminate this virus, but this virus wants to integrate its genetic materials in our host cell DNA. That's why treating of HIV, cure for HIV is difficult, because HIV integrates its genetic materials into the host cell. Night sweats, you are sweating at night. You have lymph nodes, they are swollen. You are having night sweats. That is a sign also that you could be having HIV in your early stages, what we called window stage. Chills, a fever, cold, and shivering. You're having night sweats, your body is trying to maintain that temperature. You're going to have feeling cold and shivering. Headache is another sign that you could be having HIV as well. The other sign is diarrhea. Remember, these signs are in a span of 2 to 4 weeks, or what we said, 10 to 90 days. What's the best advice to do if you start experiencing this sign? Go get your HIV checked. Remember, in this time and era, getting a HIV would be a very egregious mistake for you because there are information out there. Test your partner. If your partner is positive, encourage them to take antiretroviral drugs. Go ahead and also take PrEP if you have a HIV positive partner. That's called discordant couples. If you engaged yourself into unhealthy relationships, we all know them, your condom busted, you cut yourself, it had been used with someone who is a known HIV patient, take PEP, all right? That is some of the signs and symptoms of HIV in window stage. If you have any question, make sure you comment down below. I will be checking it. Remember, this is Health Matters Plus. My name is Professor Gomba. I'm also a certified medical laboratory technologist in Kenya. I do medical tests. Don't forget to subscribe. Let's see you on the next one. This is Health Matters Plus.